Okay, so I'm really excited to talk to you both today about the intersection between women's health and technology. To begin with, I was wondering if you could start by telling me a bit about your journeys and your stories about how you came to found each of your brands, Daye and the Natural Nipple, starting with you, Valentina.
Yeah. So I founded Daye in 2017, and I was really inspired by some of the personal gynecological health challenges that I had been experiencing since a young girl. I started my first period when I was very young. I was 9. And it was too early for anyone to have had a conversation with me about what to expect or the changes that my body was going to go through. So for a year, I thought I was dying from some kind of a shameful and mysterious disease. And then later, I eventually built up the courage to tell my parents. My dad actually took me to the emergency room because he also didn't know how to deal with my first menstruation. So this experience led me to realize that there are a lot of gaps in education and there are a lot of gaps in female healthcare. And I just think that it's one of the most important spaces to get engaged with because the size of the gender gap is just so huge in medical research.
Yeah. And was it important to you that Daye was breaking the taboos, that there's often a lot of stigmatization around certain women's health topics? Did you want to kind of change all that?
So we want to normalize conversations about gynecological health, which is still a genuine struggle. So one of our biggest challenges, for example, is that we're not allowed to advertise on traditional social media platforms because they equate anything to do with female health. So it could be menstruation, menopause, breastfeeding with adult and political content. So our ads get banned wrongfully. So there is still very much a real taboo in gynecological health. I was on the BBC last week and they asked me, so how do you use Daye's diagnostic tampon? And I said, oh, you insert it in the vaginal canal. And the journalist said, oh, it's lunchtime. Some of our listeners might be having lunch. I'm not sure we're allowed to say this on the BBC. Oh. Okay, Valentina, thank you. We'll wrap up with Valentina now. And this is just my experience every single day. People feel deeply uncomfortable with the topic of gynecological health.
No, that is, and I hope today we are, hopefully contributing to breaking those taboos.
Yeah.
And Lorraine and I just realised that we live on the exact same road in Lisbon, which is wild.
10 houses apart.
5 houses apart.
Yeah.
Crazy. Could you tell me a bit about the Natural Nipple and also your background in, terms of founding it?
Yeah, so really similar to your experience, Valentina. Like, people get so uncomfortable saying the word nipple, and it was just very intentional with the brand to, if you can't say that word, which is a part of your body, how are you going to support a woman that's trying to breastfeed in public? So it is very much in your face to acknowledge that this isn't breastfeeding and basically supporting parents through the breastfeeding journey is not. It's not a women's health issue. It's actually a humanity issue. And my background, I'm a primary care provider. I was actually in my PhD studying the microbiome of preterm infants. So trying to figure out how to prevent them from dying early because of a critical imbalance of gut bacteria that only providing breast milk longer can actually correct. So I never thought I would be a founder, but it turns out the reason that women in the States give up breastfeeding very early, also correlated with our maternity leave being only 3 months, is the introduction of a standard bottle. And so it was never biomimicked from breast when I saw the data and how no one had even studied lactation. Basically averages across the first 2 years of life to make that the benchmark for how a product should flow. You're basically we are fire hosing tiny infants and causing them to choke. And so that's really what compelled me. I realized, okay, I could publish this paper, that talks about the issue, or I can create a product that solves a gap in industry, and that's why I'm here.
Yeah, and kind of on that topic, so you both have really rigorous scientific backgrounds. How did you go about taking the science and that knowledge and packaging it in a way that was kind of understandable and accessible to people who might not have the same background, and sort of so they're really informed, but they know about your product? Yeah, starting with you, Valentina.
So Our first product that we brought to market is a pain-relieving tampon, which takes advantage of the vaginal route of drug delivery, which is actually the safest and most effective way to give medication in women, because you entirely bypass the digestive tract, you bypass the liver, and the medication gets recycled through the pelvic floor. But because it is the vaginal canal, and that contains the word vagina, people are uncomfortable, and it hasn't really been studied. So we had to conduct clinical trials in order to confirm that you can apply medications through the vaginal canal. And then we have a direct-to-consumer brand, which enables us to share information on all kinds of women's health topics and on our products in a really digestible and understandable way. And I think that's where having a medical technology background and also understanding brand marketing can be really powerful. A lot of companies tend to stay in one area or the other. So you either have a really strong brand but not enough product innovation, or you have a lot of product innovation and you're not so good at telling the story of that product. When you merge the two together, you can reach a bigger audience and make more of an impact.
Yeah, no, definitely. And did you also find that as well, that you had to kind of have the kind of brand knowledge and then also, to kind of,
Yeah, I would say I really struggle making, like, in science, we have to present background first. But in business, it's like you have 3 seconds to capture somebody's attention. But I think I'll answer that question with a quick story, because I went to Nepal basically to study why they are the global leader in continued breastfeeding to the World Health Organization's recommendation of 2 years. Anyway, interviewed the president of their breastfeeding forum, and he was actually quite exhausted, because what he does is he fights Hershey and some of these big players from introducing their bottle nipples into the hospital. And at the end of a very interesting 3-hour conversation with an old Nepalese doctor, we basically came to the conclusion, you have the power in today's day and age to reach more people through clever marketing than you do antiquated ways of gatekeeping and only relying on publication. It's how the user receives the information and in a way that they understand that matters, which is a lot of the work that you're doing, Lauren.
Yeah, well, yeah, and I know that you also use AI as well, and I guess with technology, was it important to both of you that to use technology in a way that kind of scaled so that you could reach as many women as possible, and also women who might have health as the bottom of their to-do list, between balancing careers, childcare, family responsibilities, the lion's share of housework, as the data still shows, things like that, people who are short on time. Has technology allowed you to reach them more easily, would you say? Starting with you, Lauren.
Yeah, we actually are just starting. Basically, we've been training a pediatrician in your pocket, so based on the biopsychosocial model, training an AI, which is a lot more accurate in delivering the sort of support you might need in the middle of the night if you're like, is this normal? My baby's projectile vomiting. Because otherwise you're relying on Dr. Google at that time, and a lot of those results are informed by SEO. So yes, we've found that in terms of needing instantaneous support, the advent of AI is critical. I think how we feed that we can talk to in a little bit.
Definitely. And Valentina, what's your thoughts?
Yeah, something that I feel really passionately about is providing medical information in a really digestible way, because especially in women's health, we're very frequently taught that you should blindly trust the doctor, and patients often get penalized when they go to a doctor's office and they bring their own research or they bring their own symptoms that are listed out on a piece of paper. I think it's really important that everyone has the information and the knowledge that they need in order to understand what's happening within their body and to then better advocate for themselves when they are actually connecting with medical professionals. And digital tools, technology, so everything from a blog to an app to an AI algorithm can really support patients in tracking their data, gathering insights from their data, and then making more informed decisions with their healthcare providers.
Yeah, and I remember actually that made me think, because when we spoke last year when you were launching your vaginal microphone test kit, and you said that was all made possible because of COVID in a way and having the lab set up. I don't know if you could tell us a bit about that.
Yeah, so one of our products is a diagnostic tampon. So it's like a regular menstrual tampon with an applicator. You insert it vaginally by yourself. The applicator enables you to reach your cervix by yourself without the need of a speculum. And because the tampon covers a larger percentage of the vaginal canal, we can collect a really comprehensive sample of your vaginal microbiota. The way that we were able to commercialize this technology and this innovation in an affordable way is with the reduction in costs in PCR technologies. So we analyze the DNA in your sample rather than just the microbes themselves and whether they're living or dead. We look at the DNA. And this used to be really expensive before COVID, but now after COVID, there's so many PCR machines out there that are not being used anymore for COVID testing. And there's lots of innovation in gynecological health, in endometrial cancer screening, in infection detection, in STI screening, in HPV screening, which are now possible thanks to the drastic reduction in costs in PCR kits.
Yeah. You're both obviously hugely successful in what you do, but I was wondering for other people who may have founded businesses here or be in the process of that, can you share some of the hurdles you've encountered along the way and what you learnt from those experiences? If you, Lauren, if you might like to go first.
Hurdles. Well, I think when you're developing something that doesn't exist, it's like a chicken or the egg sort of situation, and it's very difficult, I think, in today's environment to get funding to de-risk something. So I would say the process of going after like R&D backing through like the National Science Foundation, you just have to be patient. Like you have to know you really care about solving this problem, because I didn't know I was signing up for 5 years of R&D, but and then as well when you're talking about the health of the next generation, and specifically females and how they play a role in that. Yeah. It's not necessarily a sexy topic for investors, so I think really positioning it in a way that people understand has been a fun challenge for me. It's like, here's the nipple girl. It's like, no, here's I'm going to save the health of humanity and also make you money if you invest.
Yeah, no, absolutely. And Valentina, what have you encountered along the way?
So I think being an entrepreneur is really glamorized these days, and you get lots of compliments on your success on the basis of the 1% of your life that you share on LinkedIn and Instagram. But it's actually the absolute opposite of glamorous. It's a very difficult existence, especially if you're an entrepreneur in women's health, because every possible barrier is out there for you to cross. Access to public funding, access to private funding, access to talent, the huge innovation gaps that exist that you have to bridge by yourself with minimal resources because, again, capital is not available. So my advice to future entrepreneurs, I think you first need to do some soul searching before you decide whether you actually want to start a company, to confirm that you're starting a company for the right reasons. Because, we do live in a day and age where being a founder and having a startup, it's the coolest thing and it's really glamorized, but the reality is very different. The reality is like 4 hours of sleep per night and just constant challenges. So first, be really sure that you actually want to do this and that you want to do it for the right reasons. And then if you've completed your soul searching, you're convinced that this is what you want to dedicate your life to, then just be extremely persistent. So now I've just successfully gaslit myself into being convinced that every time I hear a no from an investor or a partner, I'm just grateful, because I think, okay, the one no brings me closer to a yes. Yeah. So every no that I hear, I see that as just, okay, it's a stepping stone. So have to continue climbing up in order to get to the yes.
Yeah, no, that's really brilliant advice from both of you. Thank you. And Valentina, I know you're covering this in a talk later. Of all the spending on research and development in healthcare, only 4% goes on women's health. And women's health is an area that has historically been under-researched and underfunded. Do you think that things are now heading in the right direction to close the gender health gap, or what do you still think needs to be done? Lauren, could you go first?
Yeah, this is something I'm really passionate about from a clinical and research background, because in 1977, the FDA actually banned women that were childbearing from participating in clinical trials, and it wasn't until 1993 that the NIH actually mandated that women were a part of research. So what that means is we have just only 30 years of data on how drugs and technologies potentially impact the female physiology. And so I really feel a sense of duty, like Valentina is doing as a founder, to basically generate the data we need to have patients be able to make informed and safe decisions about their body, because it's kind of tragic that we all are born with this thing, this body, and it's not implemented in primary education, basically how it works or how to use it. So, I think the data collection that we're beginning with our research and development grant starting January 15th, there's been a lot of interest from perinatal healthcare providers in terms of they saw a publication and they were like, how did you take this idea and transform it into innovation? So now we're basically scaling that into hospitals across the US, but also giving them the opportunity to develop their ideas in the perinatal space, because there's just, as you get into it, you begin to understand how many unmet needs there are. And I'm curious about your experience.
Yeah, would love to hear your thoughts.
So my experience around...
in terms of, do you think things are moving in the right direction when it comes to women's health and the focus?
So I think you mentioned 4% of public funding goes to women's health. It really varies country to country. So in the US, it's less than 2%. In the UK, it's 2.4%. In Germany, it's 0.7%. So that's if you imagine the entire pool of publicly available funding for healthcare, only 0.7 to 4% gets allocated to the entirety of women's health. So that's everything from breast cancer to endometriosis to menopause. So for me, the biggest gap that exists in gynecological health is access to public and private funding. On the private funding side of things, less than 1% of venture capital that goes to healthcare, to the whole of healthcare, goes to female-specific conditions. And what I see today is that the majority of gynecological health startups, they're built in conditions of extreme scarcity. So when I look around my group of founder friends that are female, they're so scrappy and, counting pennies and trying to find the most creative ways to conduct clinical trials and publish their data. And at some point, this will inevitably have an impact on the quality of the solutions that are being brought to market. So I think we're having lots of conversations about gynecological health and how important it is, but I haven't yet seen the industry-wide shift that we need, particularly in funding, in order to invest in research.
It's kind of like greenwashing. It's like, people want to have inclusion and diversity in terms of their portfolio, but I think there need to be more experts that are actually skilled in understanding, this is a product market fit in the perinatal or gynecological space to actually deploy that capital.
Yeah, and I know you mentioned diversity and inclusion there. I know that's something that's being talked about a lot more in the femtech space at the moment. How have both of you ensured that your products aren't just for white women, that everyone is part of that conversation? I don't know if you wouldn't mind starting, Lorraine.
Yeah, it's really... making sure you have a heterogeneous sample and research is just so important. So for our build of the natural nipple, we 3D scanned women of every single race. And so it's just, I think it's a matter of personal ethics and morality to make sure you are dedicated to inclusion.
Yeah.
How about you?
Yeah, just on a very practical level, what we do is we map the racial diversity and ethnic diversity of the populations that we want to serve, and then we look at the percentages and we match those in our clinical trial recruitment efforts, in our user testing recruitment efforts, and we work with a lot of patient groups in order to recruit patients from a specific demographic into our development efforts.
Yeah, no, it's brilliant. And I know that, so a stat that gets thrown around quite a lot at the moment is that 70% of female femtech founders are women, but the majority of investment goes into male-owned femtech companies. From both your experiences, do you know why that is, or what the barriers are, and how we can kind of change that balance? If you wouldn't mind starting, Valentina.
I think the statistic is that 70% of the capital that has gone into femtech has gone to male founders, even though the majority of founders in femtech are women.
Yeah.
That's just the reality of the space that we exist in. Venture capital investors have they have to use biases and heuristics and shortcuts to make their decisions because of the way that venture capital is structured. If you're a venture capital investor, you probably get like 20 to 30 pitch decks a day, and you maybe have 5 to 7 meetings. So you're always moving from one industry to the next and from one problem to the next. You also have to manage your LPs, your limited partners that invest in your fund. You have to manage your existing portfolio and then chase new deals. So what I've seen in the market is a lot of venture capital investors just rely on patterns that they know. So if someone went to Oxbridge or they went to an Ivy League university, they're a good founder. If they worked in consulting, they're going to be a good founder. If they're a man, and they will be a good founder. So that's what I've seen. And you see that in other statistics as well around the questions that female founders get versus male founders. There was now a study that looked at the nature of the questions that get asked of both groups, and female founders get asked questions that are more to do with how would you mitigate the risks of your business, whereas male founders get asked questions of tell us about the potential and the future opportunities and what you can achieve. So there are just systemic biases in the space.
Like the language that's used, of course. And Lorena, what did...
Yeah, it was interesting. I hosted a roundtable with a group of female founders that were just sharing their challenges. So personally, our company was mostly funded nearly $1 million in grants. So I don't have a ton of experience in the VC realm. But what they were sharing is the questions they ask are just totally off keel, inappropriate, not related to how you're going to give them ROI. But I think what's probably driving some of that is like a lot of the expertise and experience and financial literacy to date. Obviously, like if you're a VC and you see a male with a company, he has a track record of success, you want to bet on somebody that has the track record of success. So I think that we actually have the opportunity now to really shift that paradigm. I'm personally focusing a little bit more on giving people interested in taking their ideas and transforming them into innovation, alternative ways of finding funding through grants, through sponsorships, so that they can actually begin to get the financial literacy and the rapport they need to be trusted to eventually attain the venture capital that they might need.
And do you think almost if most of the people with the money to invest are men and they will kind of invest in what they know, do you think that's part of the problem as well, is that they just haven't realised there are these gaps and actually they should become a bit more educated on the gaps in a way?
We all have our cognitive biases. We all only know what we know. So I think being disruptive like you are.
I hear that all the time. Whenever this literally happens to me 1 out of 2 meetings that I have with the Mayo investor. They always start with, I could never use your products, of course. I'm like, I never thought that you would. That's fine. Like, I don't think you have a secret vagina. It's okay. You can let other people try the products and give you feedback. But women's health is just not taken as seriously as other areas. Most investors are not born with knowledge of AI or cyber technology or security. They gain this knowledge. But women's health is seen as this like less serious industry, so then people spend less time investing in their own knowledge gaps in the space.
Yeah. Oh, whoops. Fly. And just pivoting slightly, so after the Roe v. Wade ruling last year caused women to become more concerned about the data security of their period tracking apps, have you noticed an increased desire for data security among users, and how have you gone about reassuring them, both your companies? Lorena, if you could start.
So we just got started with our app development, and we partnered with Globant, who's a global leader in digital and cognitive software transformations, basically. And so I think pulling in like some of HIPAA from healthcare and just making sure that you're first of all very clear with your consumer or your patient on how that data is going to be used is first and foremost like our responsibility. And then also having a middleware that basically anonymizes. So Globant has a proprietary software that basically depersonalizes all of the consumer information. So for instance, if you fed the MLM model something about, Google is doing this, or like this is happening with my vaginal microbiome, it wouldn't be accessible to somebody on the other side. Did that answer the question?
Yes, okay. That's brilliant. Yeah, and I don't know, have you encountered this? Yeah, no, yeah.
So yes, we do similar things. We anonymize our data sets and split them into two separate databases. So your personally identifiable information will be separate from your healthcare information. And yes, we are seeing an increased interest in data protection and privacy.
Yeah, brilliant. Final question. So femtech was coined by the female founder of menstrual tracking app Clue in 2016. How do you each feel about this term? Is it a positive or a negative? Like, how do you feel? And Valentina, started with you.
I don't mind it. I think people make a bit too much of a fuss about it, but I do get a lot of satisfaction from what I've started doing recently is, how people would say, oh, she's a female CEO or she's a female inventor. I've started just saying, oh, meet my friend, the male founder. Meet my friend, the male inventor. And it's just so funny to see how perplexed people are when I say this, but then when you use the exact same opposite for women, like meet this female scientist, people are like, what?
Yeah. So true. Yeah. And how about you, Loren?
Yeah, I think to our point earlier with females being excluded from clinical trials for so long, it's important through the work you're doing, Loren, to just raise awareness of the importance in generating that data, no matter if you're in academia or in industry. But I think, like, my personal opinion is that by coining it femtech, you're basically siloing yourself into a very narrow vertical that gives you limited access to capital unless that's inside of the fund's thesis. And it doesn't really matter if a male made it, if an elephant made it. What matters is, does it work? And is it solving a problem?
Yeah. Oh, brilliant. Well, thank you both so much. Thank you, everyone, for coming.
Thank you so much.